Anatomy Trains invites you to take your career to the next level with Anatomy Trains Structural Integration, ATSI. We're kicking off the next training this September in Maine under the guidance of Tom Myers and our expert team. Come map the pattern and shape the change in this transformational 3-part certification program. Visit anatomytrains.com for details.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. Hello, listeners. It feels like ages since I've spoken with you, but that's because don't tell anyone, got a little ahead on my podcasts late in the spring, so I haven't recorded anything since the beginning of summer, and all of that is over now, of course. I thought with this episode, we could return to our I Have a Client Who roots and revisit a topic that always gets a lot of attention, DVT and the risk of pulmonary embolism. Our contributor, bless them, sent a really thorough description of this situation, and it goes like this. Hello, Ruth. Thank you for the world of knowledge that you share with this group. I'm blushing, but you're very welcome. I am a massage therapist, and I wonder if you have some resources for me to look at in regards to treating a patient who had a pulmonary embolism 2 weeks ago. She is now on Eliquis. Likely, the trigger for this was taking birth control for the last 3 to 6 months or so, even though she had a hysterectomy 2 years ago. They were using this treatment to try to impact some negative symptoms she was having from perimenopause. Of course, I have asked for clearance from her medical provider, but I honestly find that often medical providers don't really have a full scope on the physiological impacts of massage. For instance, I've had OBGYNs give patients written clearance for massage when they've been diagnosed with preeclampsia, which goes against everything I've ever learned. In those circumstances, I err on the side of caution, but I'd like to learn more about how to safely treat a patient that has experienced a pulmonary embolism and is on anticoagulants. If you know me at all, you know that steam is coming out of my ears right now. But this contributor identified exactly the reason. We cannot rely on someone else, even an extremely well-educated someone else, to determine if our work is safe. And if we do completely abdicate that responsibility, then we are perfectly capable of doing great harm, like maybe with the person with preeclampsia. If this topic of whether to rely on a doctor's clearance captures your attention, let me suggest that you take my online self-paced CE course, A Doctor's Note is Not Good Enough and What is Better. There will be a link in the show notes, because a doctor's clearance or permission or enthusiastic go-ahead does not keep our clients safe. Okay. And now back to our regularly scheduled programming. Let's do a bit of review about DVT and pulmonary embolism. You will recall, I'm sure, partly because I keep harping about this, that arteries carry blood away from the heart, veins carry blood toward the heart, and capillaries, those teeny, teeny, tiny little pathways, connect one to the other. If we get a blood clot in an artery, and it fragments and travels, it will travel until it gets to the next set of capillaries, and it can't go any further because the vessel is too small. And that might happen in a branch of the coronary artery during a heart attack, or a section of the cerebral artery during a stroke, or maybe the renal artery, or wherever. But if a blood clot forms in a vein and then fragments and travels, that debris can really only get trapped in one place, and that is the, say it with me, lungs. These clots travel through the vena cava into the chambers of the heart, and if the septum of the heart is intact, there's only one direction for them to go, which is out through the pulmonary arteries and wham, into capillaries in the lung tissue, and that is a pulmonary embolism, or a PE. And that happens somewhere around 900,000 times a year in this country, and it leads to somewhere between 50 and 100,000 deaths each year. I do want to point out that not all pulmonary embolisms begin as clots in the legs, but most of them do. And when a clot is in a deep leg vein, we call it DVT, or deep vein thrombosis. And if that DVT breaks loose and leads to a PE, then the whole thing together is called a venous thromboembolism, or VTE. And it sounds like that is exactly the situation for the client in today's story. I responded to this contributor asking a few follow-up questions, including these. Is this client at risk for another PE? Is her current treatment working, and what kinds of side effects is she dealing with? What are her activities of daily living like? Like, for instance, is it safe for her to take a brisk walk or exercise? And, most importantly, what does she want to achieve with massage? Because if she wants help with her really bad one-sided calf pain, which is a DVT alert, of course, well, that's really different than if she's hoping to sleep better or to deal with a mild headache. By the way, let's keep in mind that this person's pulmonary embolism was a whopping great 2 weeks ago. So those questions are super important to get an idea of how fragile or how robust this person is. And of course, that will inform what the massage must look like. And then I said, remarkably calmly for me, I'm sorry your feedback from some doctors hasn't been helpful, but you're right. It's not their job to know whether your work is safe. That's your job, and I appreciate your care, which is absolutely true. Well, this massage therapist and I continued to correspond, and here is their next note. Hello, Ruth, they said. Thanks so much for checking back. She has yet to get back to me after seeing her doctor and asking for some guidance. I also asked for a HIPAA release to discuss care with her provider. It's always so wonderful when the medical practices are willing to communicate about cohesive care, and that is what I'm hoping for. Well, here's Ruth again. This is a really important distinction. There's a huge difference between asking for a doctor's clearance and wanting to communicate about a person's care. And this contributor clearly gets that. Hooray! And now back to their note. Here are some of the things that I'm considering that I'm trying to conceptualize more fully, especially considering that I work mostly with perinatal clients, so vascular concerns are big on my list of contraindications and precautions. Number 1, from what I understand, lymphatic work is contraindicated when there's a concern for DVT, but isn't deep work also contraindicated in the same circumstance? So does that leave the whole reason of the legs contraindicated for some post-DVT period of time? Or when there's any concern for a potential DVT? And secondly, this client especially likes to have deep work on her neck and shoulders. She's on Eliquis, which is a blood thinner as I understand it, and deep work is generally contraindicated when on blood thinners. Would you agree with that statement? Now we get to the real nitty-gritty of this situation, and I am rubbing my hands in anticipation. Number 1, can you do lymphatic work near a suspected DVT? And is deep work also contraindicated? You'd think the answer to this would be 100% absolutely clear without any kind of controversy, wouldn't you? Because, of course, massage of any kind is absolutely forbidden in the presence of a diagnosed clot. But let's look at that more closely, just for a second. Yes, we want to be safe and ethical, and our understanding of human physiology strongly suggests that manipulating the tissue around a blood clot is a terrible, terrible, terrible idea. I concur. But what about elsewhere? Distal to the clot? Probably not. Proximal? Who knows? What if the clot is really subtle? What if it's in the pelvis, which happens a lot, by the way, so we don't even know for sure if it is or where it is? And what about elsewhere in the body? What does area around a clot actually mean? Can we work on this person's arms, their shoulders, their neck, their back, with any kind of touch? Or must we defer entirely until all risk of a blood clot is gone? And how do we establish exactly when that is? Because some clots are obvious and others are definitely not. Do you see what I mean? This is way harder than it looks. There aren't any answers that have been rigorously tested for safety, and it's not the kind of question that lends itself to ethical human testing. So my answer to this question about deep and light work is, for the sake of safety and conservatism, let's leave this area, which is to say the entirety of the affected leg, alone until she has been cleared. Not cleared to receive massage, because that's not a reliable measure, but until she has been cleared to be able to do mild exercise safely. Can she walk around the block? Can she climb stairs? Can she take a hot shower? Can she get her heart rate up? If she's encouraged to do these things, then yes, we know that gentle massage, whatever label you give it, manual lymphatic drainage or something else, is probably safe. All this said, let's remember that at the time of this correspondence, the client is a whopping 2 weeks out from her pulmonary embolism. No one really knew how things were going to shake out in terms of risk for future events or side effects of her medication, which brings us to question 2 about the use of blood thinners. I have to tell you, I love me some Eliquis. Not because I use it, at least not for my own health picture today, but because unlike its major predecessors, the side effect profile of Eliquis is much gentler for most people than we saw with Coumadin and its blood thinner colleagues. Eliquis can still cause side effects, and bruising is one of them, so it's vital to ask about this when we have clients who use it. But we are much more likely to get a report of no significant side effects now than we used to be. Can you do deep work with a client who uses Eliquis? Well, what do you think I'm going to say? It depends. Of course it depends. It depends on the client's reactions. It depends on what you define as deep work. It depends on what they define as deep work. And that is going to look different for every person. There is no one-size-fits-all answer to this question. One of my follow-up questions was about the risk for more clotting. This client used oral birth control, a form of hormone replacement therapy, to mitigate some of the symptoms of perimenopause. A risk of blood clotting and DVT is well established with oral birth control, so that turned out not to be a great option for this patient, and I hope that in addition to being treated for PE, she is also able to pursue different possibilities for her perimenopausal symptoms. A good question for her doctor, if that conversation ever happens, is whether between using Eliquis and adjusting her meds, her risk for future blood clots is considered to be managed. An educated guess is that it definitely would be, because this has now been established as a really high priority. So can this client receive deep work, whatever that means, on her neck, back, and shoulders as she would like? Probably yes, if the Eliquis doesn't make her bruise like a peach, if the client can undertake normal activities of daily living, if the massage therapist works conservatively at first and monitors results and then goes with a bit more rigor, if the massage therapist establishes some kind of plan B that gets to this goal without putting the client at risk, maybe through muscle energy technique or stretching or gentle myofascial work. And most of all, if that is what the client asks for to help her achieve her goals for massage, because that is always the most important question. of all.